HERTHENA-Lung02 study is a randomized phase 3 study comparing a HER3 DXd, which is a ADC against HER3, versus a standard chemotherapy for patients who had resistant to standard third generation EGFR TKI after the oral treatment. So there are two types. It's either the patient who took the EGFR third generation as a first line therapy, or it can be as a second line therapy after they failed their first generation T797 positive and go on the third generation. Randomized head to head. Total about 563 patients, and randomized it with the primary endpoint of looking at the BRCA progression-free survival, and for which we do have a positive outcome of a hazard ratio of 0.74. However, the median is actually very close, 5.6 versus 5.4 months. In the response rate, there is actually improved of response rate by approximately 10%. However, the overall survival is negative. There is actually a hazard ratio of 0.94, no different in the overall survival. Toxicity-wise, there's actually a slightly higher GI and hematological toxicity. So that, it has to be adjusted, with some support, but it's a manageable situation. So overall, we do have an improvement in response rate, improvement in progression-free survival, but no difference in overall survival.